Welcome everybody. This is our live Q&A for hormones, menopause, perimenopause, and hormone replacement. So we're just going to be answering your questions live on this call. If you have questions and you're watching the replay, just pop them under the video and we will get to those as well. So one thing I wanted to announce is we are doing a special give back promotion. So for every person that joins the Healthy Hormone Club between now and December 16th, we're going to purchase a present for a child in need. And you're also going to get access to our Healthy Hormone Academy for free. So it's a gift for you and a gift for someone in need. We'll be kind of posting about that coming up. And then the other announcement I wanted to make is if you have any questions and you want some more support and you're not in one of our programs, you can join our Facebook group, which is called the Glow Tribe. We're going to be much more active in that Facebook group as of next week, right after Thanksgiving. We're really going to ramp up some more trainings and challenges and just more support in there. So that's always a good place to go. All right. So don't forget to put your questions, if you're watching live, put your questions in the Q&A box. And if you are watching the replay, just pop your questions below the video. All right. So I'm Dr. Michelle Sands. For those of you who don't know, I'm a licensed naturopathic physician and female hormone expert. So I work a lot with bioidentical hormones, menopause, perimenopause, but also with infertility and period problems as well. So let's get into the first kind of question that I want to deal with. And that is, does estrogen cause cancer? And the short answer is no, estrogen does not cause cancer, but why does everybody think it causes cancer then? Why do doctors say estrogen causes cancer? Why do you hear about that in the news? What is the connection? Well, up until 2002, hormone replacement was very much given out to women who reached the menopause age. It was just a common thing. It was given out all the time. Oral estrogen, synthetic progesterone, if you had a uterus, and then just the estrogen if you didn't have a uterus. So if you had a hysterectomy, and so that was basically how it went. Progesterone was thought to only be needed if you had a uterus to protect the uterus from rapid growth of the endometrial tissue. And so women went along doing this for years, and even up until 1974, when tamoxifen came on the market, high dose estrogen was actually used as a treatment for women with metastatic breast cancer, and it was actually a successful treatment. So what happened in 2002? Well, there was a study called the Women's Health Initiative Study, the WHI study. And it was actually a study that was conducted for pretty noble purposes. What they were trying to prove was they just wanted the scientific proof that all the wonderful things they had seen as a result of women taking hormone replacement therapy, they just wanted to prove it with a study. So the heart health improvements, the breast cancer protection, the osteoporosis improvement. So all of these things, the main one they were looking at was heart disease risk, how that decreased with hormone replacement, because heart disease is the #1 killer in women. And so they started the study, and there was actually 2 arms of the study. So there was the women who had uteruses and the women who did not have uteruses. So the women who did not have a uterus because they had a hysterectomy, they would be put on conjugated equine estrogen. So it's an oral estrogen that is derived from a horse. So conjugated equine, that means put together from a horse. And it was called Premarin. And that was the popular prescription at the time. So that was what most women were given if they were given hormone replacement therapy. They were given Premarin, pregnant mare's urine. And that's what it's derived from. Hormone replacement therapy originally was derived from human urine, and then that wasn't really sustainable. So they figured, let's just do it from horses. And unfortunately, horses' estrogen is like 10 times more potent, or maybe even more than that, more potent than women's hormones. And horses have about 17 to 20 different estrogens. 10 to 12 of them were in the Premarin, and none of those are identical to what human women make. So that we have 3 estrogens in our body. We have estrone, estradiol, and estriol, but horses don't have any of those. They have different ones. So it still worked for hot flashes. It still worked for a lot of things. And we just don't really use that anymore. So it's an oral estrogen that was taken. So that was one group, the group of women without the uteruses. Then we have the group of women who had uteruses, so who had not had hysterectomies. And those women were given the Premarin plus a synthetic progestin. So not progesterone, but a synthetic progestin, similar to what's in birth control pills. This was called medroxyprogesterone acetate, or MPA, medroxyprogesterone acetate. And so this was combined together with the Premarin, and that was called Provera. And so that was what they got in that arm in a study. So they went along the study, and several years in, they actually noticed that some of the women were starting to get breast cancer, and some of the women were not feeling good. They had a higher risk of stroke. So they actually stopped the study right here. So they're like, okay, let's stop. And what happened was the arm of the study where they were getting the synthetic progestin in addition to the estrogen, they had an increased risk of breast cancer. And they also had an increased risk of blood clotting, and they had an increased risk of stroke. And so there were some issues there. And the media picked up on this stoppage of the study, and they reported that hormone replacement therapy causes cancer. It actually was like a 26% increase in cancer from the women who did not take any hormones to the women who took the combined progestin plus equine estrogen. And so that was reported, and women all over the world were yanked off their hormone replacement therapy. Hormone companies were sued. No doctor wanted to get anywhere near hormone replacement because of these headlines. However, what was not in the headline was that the women who were on the estrogen only, they actually had less breast cancer than women who did not take hormones at all. Basically, they had a reduction in ductal breast cancer by 31%. 31%. And this arm of the study actually kept going, the estrogen only arm. And then they actually did a follow-up after 10 years, and they actually found that there was a significant lower risk of breast cancer, of all types of cancers, in this group. So this was huge. And women on the synthetic progestins, however, those are the ones at greater risk. Estrogen only, lower risk, and also had heart protective effects, so had less risk of heart disease as well. That did not get publicized. But somehow all the doctors somehow had equated estrogen to causing cancer and estrogen to causing heart disease. And this is not true at all. They actually did a reanalysis, many reanalysis of this study. This is a 2002 study. This is over 20 years ago. And so Yale University they actually had the International Menopause Society committee, and they actually did a whole reanalysis of the study. And they actually showed that the estrogen only arm had a 44% less risk of breast cancer than women who did not take hormones at all. Now, doctors and patients were not hearing this news. This was actually sent to associations, it was sent to medical boards, but it was not trickled down into standard of care at all. And I don't know if it's for fear of lawsuits or why it didn't come out, but it was not publicized at all, and the media did not pick that up. Stanford had another study. The Department of Medicine at Stanford actually reanalyzed these and found the same thing. And then in 2019, there was a San Antonio Breast Cancer Symposium. So the San Antonio Breast Cancer Symposium was a huge event in San Antonio. They actually do it every year. You can look up the San Antonio Breast Cancer Symposium. And they actually had over 16 of the lead cancer research groups, pretty much anyone who is anyone, Los Angeles Biomedical Research Board, Fred Huntington Cancer Research Center, Brigham's Women's Hospital in Massachusetts, Stanford Prevention Research Center, Ohio State University, University of Tennessee Science Center. So pretty much all of these huge cancer research studies, they actually all agreed and submitted a paper that said that the Estrogen causes a reduced risk of breast cancer, and it actually causes a reduction in deaths from all causes, all cause mortality, and has an improvement in women's overall health, meaning heart disease protection, osteoporosis protection, the list goes on and on. They did also verify that the progestin, the synthetic progestin, the medroxyprogesterone acetate, is what significantly increases risk of disease. We know now that oral estrogens can actually increase the risk of clotting because it has to go through your mouth and through your digestive system, and then it has to be metabolized by the liver, and that creates these clotting factors. So that can cause risk of stroke and blood clotting. And so that's why we never recommend oral estrogens at all. And most people don't. So that's kind of like a little reanalysis of the study. And then if you use your common sense and think about estrogen and women as a whole, you have to think, as women age, they have less estrogen, and breast cancer risk increases when women have less estrogen. So as you get older, you have a less estrogenic state, and you are less protected from breast cancer because estrogen is protective. So if estrogen was carcinogenic, then we would see women who are at the height of their hormones have the highest level of estrogens. Those would be the women who are getting the most breast cancer diagnoses. Now, pregnancy is a state when we have the highest estrogen exposure in a woman's life altogether. So that pregnancy, we know, and almost every peer-reviewed study has shown that pregnancy is actually protective against breast cancer. And the younger you are when you get pregnant, the more protective it is. They actually found that never having a baby increases a woman's risk of getting breast cancer by 30%. 30% increased risk if you don't have a baby. And they actually found that women who have children under the age of 18, now I'm not recommending this, but they have like almost no cancer diagnoses. So I'm not saying at the time they're 18, I'm saying if a woman had a baby before she was 18 and now she's 65, she almost has a 0 chance of getting breast cancer, provided she's not smoking and being exposed to a bunch of toxins and is overweight and drinking a bunch of alcohol, because those are all risk factors in and of themselves. The other thing is, you might be thinking, what if I have a genetic mutation? What if I have the BRCA genes or the BRCA genes? Now, these genes are known to inhibit the body's ability to prevent the spread of cancer. That's what those genes do. So nothing to do with estrogen, but what they do is, so we have these stem cells. We have cancer cells in our breast. Everybody has about 5% of their breast cells have cancer. And then all of our breast cells have estrogen receptors. And sometimes if you have a cancer that's starting to grow, the BRCA genes, that kind of puts the brakes on it. And people who don't have those genes tend to have less of an ability to put the brakes on it. But what they found is that women who became pregnant earlier in their life, or just had multiple pregnancies, have a lower chance of getting cancer, even if they have the BRCA genes. And this is because of the exposure to estrogen. So estrogen, like I said earlier, was actually used as a cancer treatment. High dose estrogen was used as a cancer treatment beginning in the 1940s, and it was actually the first successful breast cancer therapy. And so using oral estrogen to treat breast cancer was a thing until about 1970, when tamoxifen was released. Tamoxifen is the hormone blocking medication, but it's not actually a hormone blocking medication. It actually blocks the action of hormones in the breasts and the uterus, but actually increases hormones elsewhere. And so that's kind of my little soapbox kind of explanation of why estrogen doesn't cause cancer and why it's actually helpful and preventative. Now, in our practice, we use topical estrogens, and I feel like that is super important because topically applied estrogens do not increase any of the clotting factors, do not have any risk whatsoever. And we use a combination of estriol and estradiol. Now, estriol actually works on certain cell receptors that actually are more protective against cancer. So estriol is a wonderful addition to estrogen, to estradiol. It's called bi-S, and I really recommend that for protection, for cancer protection overall. All right, so that's kind of my two cents on estrogen and cancer. Does it cause cancer? No, actually stem cells cause cancer. Like I said, every single cell in your breast has estrogen receptors in it when it's healthy, right? So if someone says, I have estrogen receptor positive cancer, what that means is the cancer cell, the cell that's been taken over by cancer, still has that estrogen receptor in it that it had before. So it hasn't mutated that much yet, and that's a good thing. Now, if you have a cancer cell that doesn't have any estrogen receptors, that means that it's gone further. It's gone through a further metamorphosis away from its natural state. And so I really feel as though, and more studies are being done. There's actually a great book called Estrogen Matters. Estrogen Matters is written by an oncologist who has done lots of research in the field of estrogen and treatment of cancer. They're actually doing a lot more studies right now on, is it actually beneficial to give women who actually have cancer right now estrogen to help suppress the cancer or help the cancer cells die? And there's a lot of studies that are recently emerged that after tamoxifen use, if you give estrogen, that will actually help any remaining cancer cells to die. And it is true that women have a less chance of recurrence if they are on hormone replacement, and they have better outcomes overall. So they have less of a chance of dying of cancer if they've been on hormone replacement or are currently on hormone replacement. So, but it has to be topical, it has to be bioidentical, because although I will admit that even synthetic hormones do decrease the risk, because that's what was used in most of these studies. But bioidentical hormones, there's actually even more studies that have recently come out showing how not only beneficial they are, but how they don't have any risks associated with them. So it's all actually a benefit. And so that's kind of my soapbox. I'm going to answer your questions now. Let's see. Sandra says, because I have hypothyroidism, I've been avoiding replacing estrogen. I only replace progesterone and testosterone and DHEA, which are friends of the thyroid, and estrogen is not exactly. Estrogen is necessary for proper thyroid function. So without estrogen, you can actually lose cells in your thyroid. You can actually have thyroid atrophy. So estrogen, when it's in balance, is actually super supportive of the thyroid. And we actually see more hypothyroidism diagnoses as women enter perimenopause and menopause due to the lack of estrogen. So it's definitely beneficial. But the thing is with hormones, and all hormones, this is true for testosterone, this is true for progesterone, it has to be the right amount. It has to be Goldilocks. So too much progesterone is actually not good for thyroid. And too much estrogen is not good for thyroid. Too much testosterone is not good for thyroid. So you have to have the right amount. And so we like to test levels and see, and we like to always monitor. And after a few months, we're going to test levels again and make sure that you stay in the healthy zone, because, and it's a range, not everybody's going to have the exact amount of estrogen, the exact amount of progesterone, or even the exact ratio. There's a range that's healthy, and everybody's symptoms and how you feel. I'm going to feel really good at one level of estrogen and progesterone and testosterone. And then my best friend is going to feel really good at a different level. So it's about your symptoms, it's about your testing, it's about staying in a healthy range, and it's also about supporting the other functions of your body. You can't just take hormones and expect to feel awesome if you're not eating healthy and you're not exercising, you're not doing stress reduction. So it's not the golden ticket to everything, and you can just like sit on a couch and eat chocolate and ice cream and you're going to be fine. But it is a huge benefit. Women, like I said, women who are on hormone replacement therapy live longer than women who don't. This is the study by Cancer. The Cancer Journal came out earlier this year, and there's several studies that prove that. Let's see, what can I do if I do safely if I had estrogen dominant breast cancer treatment and now my vulva has shrunk and I'm getting excited to take steroid? Well, number one, even if you currently have breast cancer, you can use vaginal estrogen. You can definitely use vaginal estrogen and vaginal DHEA to help with all the urogenital symptoms. So atrophy, vaginal dryness, painful sex, thinning of the walls, all of that stuff. Because the vaginal estrogen stays local to the vaginal tissues and it does not go systemic. However, I don't know if you currently have estrogen dominant cancer, you currently have a breast cancer or uterine cancer, but if you've had it in the past, you can still take hormone replacement therapy. In my practice, I like you to be off hormone suppressing drugs for at least 1 year and be at least cancer free for at least 1 year. But the new research is coming out saying that even if you have cancer, that it could be beneficial too. So I haven't implemented that in my practice yet, but I am currently being mentored and learning more about this research. So I might have a different philosophy or different approach to breast cancer patients in a year or two once I have more of that data. Let's see, I'm seeing a hormone specialist to do blood work. They drew 6 or 7 tubes of blood, and you mentioned that we will send our samples. Can you clarify how you do the testing? Oh, in our program, because we use topical hormone replacement, we do salivary and dry blood spot testing because serum doesn't show all of the free amounts of hormones that are available for use and doesn't show, because we're not looking at hormones in the blood, we're looking at hormones in the tissues. And so the saliva and the dry blood spot are more indicative of topical hormones. Topical hormones don't show up very much in serum or in dry urine. Okay, let's see. Vaginal estrogen does not cause breast cancer. No estrogen causes breast cancer. Let's see, but vaginal estrogen does not go systemic. So even every oncologist I've talked to over the last few years agrees that vaginal estrogen is safe for women who have breast cancer, have had breast cancer. And then most well-researched physicians understand that even if you have had breast cancer, that taking systemic estrogen can help prevent reoccurrence, can help improve your quality of life, and can help prevent heart disease, stroke, Alzheimer's, osteoporosis, and all of those things. So, but if you're worried or someone has told you you can't take estrogen, you can definitely take vaginal estrogen. Okay, I'm going to go to the Q&A because I've been looking over at the chat. So let's see. I have sleep feeling really DIAT. I'm not sure what that means. Randy, maybe rephrase that as a question. And this is about hormones, hormone replacement, menopause and perimenopause. So we're not going to discuss vitamins that are kosher and things like that. That's like a whole nother topic. Let's see. Currently, I'm on hormones that I thought were bioidentical, but I don't think they are. How do I transition to yours? So if you want to, if you're currently on hormones and you're not happy with them, or you're not happy with the treatment that you're receiving, if you're not getting answers to what you're doing, it's not a holistic process, you can certainly transition to the Healthy Hormone Club, because we not only provide you with the hormones and the testing and the support, but we also provide you with a whole holistic program to go along with it, so you can have the best optimal hormone balance. So you would just stay on your hormones that you're currently on. If you want to sign up for the Healthy Hormone Club, it's healthyhormoneclub.com. When you sign up, we're going to ask you to fill out a few forms. One of them is a health history and hormone intake form. So you'd fill that out. It's all electronic. So you'd fill that out, and then we review that, because we review everybody's medical forms first. And if you're good to go, clear to do the program, then we will order you a test. And you want to continue taking your hormones. When you get that test, you want to take your hormones, if they're topical or oral, you want to take however they are taken. You want to have your last dose between 12 and 24 hours of collection of the test, because that's going to give us accurate assessment of where your current hormones are at on your current dose. And we're also going to ask you a whole questionnaire about your symptoms. So we want to know the severity of each symptom of high and low estrogen, high and low progesterone, high and low testosterone, high and low cortisol, high and low thyroid, metabolic syndrome, inflammation. And so we're going to get the whole picture on your current dose. And then we'll be able to adjust and kind of match your current dose if you're doing great on that with our hormones, or we will tweak the ratios and the dose if you're still having symptoms. Uh-oh, my throat. I better drink some water. Okay. All right, here we go. let's see, I'm 44 and I'm told I'm postmenopausal. FSH is over 95, taken twice. Yeah, so if FSH is over 30 or 30, over 35, it's pretty good to know that you pretty much have a menopause diagnosis. And if you haven't had a period for over a year, that's like the second way to know. But if you're on certain types of birth control, you won't really know. And so the FSH is the way to know. So it does seem that you're postmenopausal. I assume that I am in fact in that stage, also have other symptoms. My question is, if I do HRT, should I take them all the way until 51? If you do HRT, you can take them as long as you want. There's no end date for hormone replacement therapy. So when your ovaries stop working, your ovaries are your hormone producers, right, in your body. So it's your factory for making estrogen and progesterone and testosterone. You also make DHEA from your adrenal glands, and your DHEA, as long as your adrenal glands are functioning well, you're going to make DHEA, and your DHEA converts to testosterone. That's where about like more than 50% of your testosterone comes from the DHEA from your adrenals. So you're still going to have, maybe you might still have decent testosterone levels after menopause. However, you're really not going to make you're make hardly any estrogen and progesterone, nearly nothing. And so all the symptoms of low estrogen, the osteoporosis, the increased heart disease, the hot flashes, the vaginal dryness, thin skin, loss of collagen, rapid aging, hair loss, all the things, achy joints, all the things we think about, those are going to be solved by replacing the estrogen and progesterone, right? So you're going to replace the estrogen and progesterone that you're no longer making every day. If you, once you stop taking that, let's say you get to 51 and someone told you, oh, you should stop taking hormones now. So you'll stop taking those, but then the symptoms will start coming back that you had from not having hormones. You will have a benefit, as that would be about 6 years on hormone replacement. So you will have a benefit to your bones because you would have had that extra hormones for your bones. You will have a benefit for your heart. You will have some benefit for breast cancer protection, but you'd be better off staying on your hormones for longer. You know, we live now. It used to be that people used to live to like 55, 60, 65, and that was like old age and people would die of natural causes. But now we're living to 80, 90, 100. So you got more than half your life to go. And it's a personal decision. So I don't think I'm pushing this on you, but it's definitely a personal decision if you want to live those years without your hormones and, you know, brain fog and achy and tired and depressed and all the things that come along with no hormones. Or you can continue your hormones. Bioidentical hormone replacement is super safe to continue for a really long time until you die if you want to. So there's no reason to get off of it. And that's even the North American Menopause Society, which is super conservative. They even came out with that in their most recent 2002 position statement, and they're super conservative. Like they are very conservative, but even they say that you no longer have an end date for your hormones. The reason why they used to say take hormones for the shortest amount of time, and they used to say 5 to 10 years was like the limit, was because the only hormones that were being prescribed was the synthetic horse estrogen and the synthetic medroxyprogesterone acetate. So because they had dangers to them, if something's dangerous, but it's kind of giving you symptom relief, you want to do it for the least amount of time possible. But if something's not dangerous and is giving you symptom relief and is actually building health, you want to continue that as long as possible. So there's my answer there. Do you recommend bioidentical hormones for osteoporosis? Absolutely. Number one cause of osteoporosis is actually estrogen deficiency. So as we lose estrogen, our bones start to get more porous, they start to get more brittle, and we're more likely to have breaks. Now, in addition to estrogen, of course, there's other things that come into play. There's nutrition. So you have to have minerals, you have to have protein. So that's important. Weight-bearing exercise, walking, carrying your own body weight, doing resistance training with bands or weights, that's important too. So those things will help to shore up your bones, and those will actually be like complementary to your estrogen replacement. There is no single more beneficial thing to do than bioidentical hormone replacement. Estrogen is the big one, but progesterone and testosterone have a play as well. So making sure all three of those hormones are in optimal ranges is going to keep your bones as strong as possible. And there's staggering statistics about women who break a bone with osteoporosis, how there's like a 50% chance that you're going to die within a year of breaking that bone. It seems alarming and it seems crazy. Like, why would you die from breaking a bone? But it's the deterioration of the body. And that's just the thing that broke first. But it's also because you have so little estrogen that it's also damage to your heart. It's damage to your arteries. There's inflammation. And so it's really a startling statistic. And yes, definitely estrogen replacement or bioidentical hormone replacement as a whole, balancing the hormones is going to be super important. Let's see. Hi, I'm 50. I skipped my period for 3 months in a row, but then got it again, followed by 2 months of no period. My gynecologist said that I'm not quite going through menopause, so she would put me on estradiol and progesterone for 2 weeks of the month, followed by 400 milligrams the second 2 weeks. I'm not sure what to do. I'm having really weird hot flashes. They're more than just horrible pressure in my head, ringing in my ears. So yes, I mean, first of all, what you're going through is extremely normal. Menopause. Perimenopause is simply around menopause. So it's the 5 to 10 years leading up to menopause. The first thing that starts happening, well, there's kind of two first things. Sometimes it's your period starts to get irregular, which is what's happening to you. Sometimes you start to get some hot flashes first. Sometimes you have trouble sleeping. All the symptoms that you're explaining are fairly common for the stage that you're in. Now, one thing about perimenopause is that it's a time of fluctuation. So you're gonna have some months where your hormones are super low. You might have some months where your hormones are kind of okay. Usually progesterone is going to drop first and then estrogen. And it depends how long this has been going on. You might be at the very beginning. And I would recommend hormone replacement for you to kind of balance that out. And, I'd recommend continuing to adjust it as things change, but you should, sorry, I've had a sore throat. I'm trying my best. You should have adjustments made to your hormones. You should see some symptom relief, of course. Now, when we lose estrogen, our hypothalamus in our brain, so our hypothalamus is the part of our brain that has a temperature regulation. When we lose estrogen, our hypothalamus actually shrinks and it's not able to communicate as well. That biofeedback is not there as much. And so has a hard time knowing whether you're hot or cold. And it kind of goes wonky and can make you hot, can make you cold. And that's why you're having hot flashes. And the ringing in the ears is actually lack of estrogen as well. I actually have a handout that I'll send with the replay when I send the email tomorrow and let you guys know about the replay. It's the 99 symptoms of menopause. And most people don't know tinnitus, that's a very common symptom of menopause. Itchy, crawly skin, very common symptom of menopause. Digestive issues, very common symptom. And these are all, when I say menopause, I'm really talking about the menopause transition. So I'm talking about the time leading up to menopause. Menopause is actually the one day. It's like the 1 day anniversary of your last period, or, so that's menopause. The term is really perimenopause, menopause, and postmenopause. So the day after that day, that's the anniversary of your last period, you're in postmenopause for the rest of your life. So when I say menopause, I'm talking about the whole transition period and afterwards, if that makes sense. Let's see, I don't have health insurance. I'm eager to get my menopause under control. Do you accept care credit for payment? We're not participating in any insurance. If care credit is used like a credit card, like if you can use it as if it's a credit card, we do accept HSA and FSA cards. So health savings accounts, flexible spending accounts, those can be used. I haven't had anyone ask about care credit. You can totally email support@glownaturalwellness.com. We might be able to accept that. I'm not 100% sure. So thanks for asking. Definitely email us at support@glownaturalwellness.com. Let's see. I've been on BHRT for 30 years in a capsule form. Why would I change over to a cream? I would just say oral. If you're taking oral estrogen, it does create those clotting factors that can put you at more risk for a stroke. But if you're doing absolutely fine on your current regime, then just as long as you're monitoring all your vitals and stuff like that, your doctor's checking on you, I would say just keep doing what you're doing if you're doing really well and you don't have any issues. If you're on synthetic hormones, though, I would definitely switch, even if you are feeling good, just because there are health risks associated with those. Paige says she can barely hear. Can you guys just let me know in the chat real quick if there's issues with my audio? Just like pop in the chat and say, hi, I can hear you fine. Or I can't, maybe because I'm sitting and my microphone's over here, so maybe I need to be closer. It's fine now. Is it because I sat back a little bit? I don't know. Paige, I'm sorry. Let me know if you can hear me now. I think that I might have just like moved away from my microphone, so I'll try to sit closer. Let's see. Are you able to prescribe hormones in all states, or do you use over-the-counter bioidentical and then tell us a dosing based on the results? I also know labs. I also know lab test thyroid in program, but do you prescribe pig hormone? Let's see. We can offer hormone replacement in the entire United States and also in other English-speaking countries. We actually manufacture our own bioidentical hormone creams in an FDA-registered facility here in the United States, and able to provide those with our program because we do testing and counseling. And so that's how we have it set up. We do use thyroid glandulars, if that's what you're talking about. The thyroid testing can be added on. So in our Healthy Hormone Club, that is strictly for balancing hormones, sex hormones. So it's estrogen, it's progesterone, it's testosterone. We also look at DHEA. And so those hormones are the ones that we work to replace. But if you want to add on a thyroid test, you can absolutely do that. And if needed, we can recommend thyroid glandulars, or we can also help you work with your own physician on like getting another prescription for like Synthroid or something like that, or Cytomel if you wanted the synthetic T3. Now, synthetic thyroid hormones, by the way, are not the same as synthetic bioidentical hormones. So synthetic thyroid hormones are actually the same as our thyroid hormone. They're just made in the lab, or you can get thyroid glandulars that are derived from pigs or cows. But the synthetic ones, so for those who are vegetarian or those who are grossed out by taking something from a pig or a cow, the synthetic ones are actually chemically the same as our thyroid hormone, whereas synthetic estrogen, synthetic progesterone, synthetic testosterone, those are not chemically the same. So if you've seen like biology class or chemistry class, there's like a chemical structure to every compound, and it has like the little octagons that are together with the little tails, and that's what makes the molecule the molecule. Well, the estrogen, the chemical structure of horse estrogen is very different than the chemical structure of estradiol or estriol. And so with thyroid hormones, the T3 is exactly the same as the T3 that your body makes, whether it's Cytomel or whether it's derived from a glandular like the armor or something like that. Same thing with Synthroid and T4. So you don't really have to worry as much with the thyroid hormones as you do with the sex hormones. Let's see, I have an IUD. Does this curb menopause symptoms? Sometimes they can. IUDs tend to have synthetic progestins in them. Usually you don't have estrogen in those. So a lot of the menopause symptoms are going to be from lack of estrogen. So there's that. See, my estrogen package says estradiol 17B. Is this bioidentical? Yes, that is bioidentical. That is. So 17B estradiol is bioidentical. What is the difference between your test and the Dutch test? So it's not my test. We use a lab, so I don't make the test. We do use the Dutch test in our practice to look at hormone metabolites and to look at cortisol and to look at melatonin, but that's only for the hormones your body is naturally making. If you're taking topical hormones, you're not going to see that on the Dutch test. And the Dutch test doesn't give you the actual total hormones. So if you look at, like, for instance, progesterone, there's no number for total progesterone there. It's only an estimate because of they're measuring hormone metabolites. So a metabolite is the breakdown product that gets excreted from your urine. That's not a direct correlation to the actual total amount of hormones in your system. And when we're measuring topical hormones, we're looking at the free hormones in the saliva, which is indicative of what's in the tissues, or we're using capillary blood, which is exactly what's in your tissues. I do love the Dutch test, but it's not the best test for looking at total hormone levels. If you do like a Dutch test and then you do like, let's say you're not on any hormones and you do a Dutch test and you do a blood test, you're going to have way different numbers for your total hormones. And so I do love the Dutch test, but just for the metabolic pathways, not for the total hormone levels. All right, let's see. Because I have hypothyroidism, I've been avoiding, I answered that one already. So you want healthy hormone levels, you want hormone balance. If you have hypothyroidism, you should not do hormone replacement at all. I actually have a video on my YouTube channel about the effects of low estrogen and high estrogen, low progesterone, high progesterone on thyroid. So you can check that out. So do you recommend using estriol? Can you use a phytoestrogen in addition? I have always been very hormone sensitive. I've been afraid to use estriol. So estriol is the weakest estrogen. So estriol, if you are sensitive, it's probably not going to have any issues, but estriol also doesn't do all the things estradiol does. So estriol, I like to use it in combination with estradiol because it's protective, one. So it's breast protective, it's cancer protective, but two, it kind of is like a little helper to estradiol where it will help with moisture. So it helps with vaginal dryness. And the estradiol is going to do the bone health. It's going to do the heart health. It's going to help you replace collagen in your skin. It's going to help with joint pain. It's going to help with depression. It's going to help with your hair, your skin, your nails. It's going to help with tinnitus. It's going to help with inflammation. It's going to help reduce insulin resistance. It's going to help with preventing high cholesterol. So estradiol is the one that does all the things, helps with your sex drive, helps you build muscle. So there's actually cells in your muscles that have estrogen receptors. And if you don't have enough estrogen, it's very hard to build muscle. Estrogen is very anabolic. So, and then estrogen is also important for our serotonin in our brain. So our happy hormone, our dopamine as well. So this is why we have depression when we don't have enough hormones. It's very common to have depression. So estriol is going to be great if you want to use it vaginally or you want to use it in addition to estradiol, but it's not going to do all the things that you want it to do. How do you get tested and how does one test when all your hormones fluctuate? So hormones fluctuate in a pattern. And so we test on a specific day at a specific time. And that's how we're able to look at that. I'm in Central New York. Just email us at support@Natural Wellness and we can explain to you, we can show you how you can do this even if you're in New York. Let's see. Is it recommended to add estrogen during perimenopause if you're low? So we always do testing to see where you're at. Usually in the beginning of perimenopause, usually estrogen is usually still pretty decent and when I say usually because every woman's different. Usually progesterone is going to decline first. Testosterone might decline or it might not. It depends on you and your lifestyle and your genetics. And so when you're still in perimenopause, you will need estrogen eventually. And that's actually the best time to start taking it before like things start going really downhill because you've been without estrogen for so long. So it's going to be individual for each person based on testing, based on symptoms. And that's why we meet with everybody. We talk to them about their symptoms. We talk to them about their levels. And that gives us an idea of whether or not they're going to need estrogen, whether they need just a little tiny bit of estrogen right now. And then in a few years, they need more estrogen. And so it's all about making you feel your best and preventing negative symptoms from happening. Okay, I'm taking letrozole. I was treated for breast cancer driven by estrogen. What can I take to replace it in a natural way? It depends. So if you're currently taking hormone suppressing medication, then we just have you wait until you don't need that any longer. Or we can do vaginal estrogen and progesterone. So there's a lot of things you can do. So you can email us at support@naturalwellness.com and we can let you know your options. Let's see, I took bioidentical hormones in the past made by a compound pharmacy and sublingual, but the progesterone or estrogen portion made me spot. And then eventually it was like I had a full period. Prior to this, I hadn't had a period in 10 years. I'm 60. Periods stopped when I was 50. Could the same thing happen with bioidentical topical treatments. So usually that means that you're not on the right amount. We see the periods come back when people are on excessive doses. That's an issue. There is a possibility, I would say about less than 10%, like maybe like 7 to 8% of women, when they start hormone replacement therapy, might have some spotting or some breakthrough bleeding for the first 2 to 3 months. But it shouldn't be a real period, and it's not something that would continue. If you're having an estriol period, then that is usually because you're on too high level of hormones or not the right ratio. So yeah, it doesn't usually happen with our situation. If there is a period like after 10 years, we usually would recommend like going to get a gynecological exam, because it could be a fibroid or it could be some type of cyst that erupted. So there's a lot of different things it could be. But it's not usually what you would see from taking bioidentical hormones or topical hormones. See, I'm 44. I'm told I'm postmenopausal. Oh, we answered that one already. Let's see. If I join a healthy hormone club, will you also look at already run thyroid? Yes, we will, depending on how old they are. So if your thyroid labs are more than 3 months old, then we're going to recommend you get new testing, because we don't want to be telling you what to do for your old you. So it's something that's recent, we would totally look at. Hey, let's see. Sorry, I'm at flat. Oh, you're feeling flat. Not sure if I should start with estriol or not. It's hard for me to say. Estriol, like I said, can help with vaginal dryness. If that's your only issue, then use it vaginally and you'll be great. Otherwise, it's not really going to do that much for you system-wide when it's not taken alongside estradiol. Let's see. How out of the range of normal is postmenopause at the age of 44? It's actually not that much out of normal. So the average age, so there's people who start before, there's people who start after. Average age of is 51 right now in the United States, but there's going to be lots of women that get it earlier and lots of women that get it later. So under 40 is considered early pause, but over 40, that's completely normal. So that's nothing wrong with you. It's just, how it is. I mean, someone would be like, yay, I don't have to use tampons anymore. This is awesome. But, there's nothing wrong with you. It doesn't put you at any higher risk other than more years without estrogen. So if you do hormone replacement therapy, you're going to be fine. Let's see, I'm 59. I have total vaginal dryness and atrophy, no libido for about 7 years. Well, of course, if you have vaginal atrophy and you have vaginal dryness, it's going to hurt to have sex and you're not going to want to have it. Your brain is like, I don't want any of that because my body is not ready for it. So yeah, that's totally understandable. And you are not alone. 100% of women who go through menopause will experience vaginal dryness and atrophy if they don't use hormone replacement. 100% of women. My doctors say they don't test. They start with estriol to monitor symptoms. Now my MD is saying the same thing. He's prescribing a 0.5 milligram cream of estriol. Is that all I would need? It will help with the dryness, but it won't help with the atrophy. You actually need the estradiol for that. But I mean, see how it is, see how you feel. You might think it's fine. Personally, I would probably go with estradiol as well. And there's no risk to estradiol. I don't know why they wouldn't give you estradiol unless they maybe aren't licensed to do so. Let's see. I have zero progesterone and having problems with my nails. Would replacement help? I'm at age 62, menopausal on BHRT. And it's possible, but it's also possible that you might have a nutrient deficiency. So it's hard to say without knowing more about you. Progesterone would definitely help with your hair, with your brain health, with bone health. It'll help with moods and memory. So those are things that progesterone will really help with. But I don't know. I mean, it can hurt as long as it's bioidentical. Usually estrogen would help with your nails. So make sure you're on the right amount. Will my skin, joint pain, hair thinning become better changing to proper bioidentical mix? Quite possibly. So if you're not on the right dosage, then you might not get the full benefit. But joint pain, it happens definitely because of estrogen. Hair thinning could be a variety of different things. So it could be low estrogen, but it also could be low thyroid. It could be stress. It could be nutrient deficiencies, and it could also be genetic. So looking at the other people in your family, when they start losing their hair or having hair thinning, that could be part of it too. So I don't want to make you guys think that this is like the magic fix all for everything, because there's other aspects of our health too that come into play. let's see. Oh, thank you for saying you can hear me. Is it possible for NP thyroid to increase your heart rate? Absolutely. So hypothyroidism, hypo means low thyroid, and that slows everything down. It makes you tired. It slows your metabolism. It makes you cold. It causes constipation. And that's not enough thyroid hormone. So if you're taking thyroid hormone to replace that, you have to make sure you're taking the right amount. If you take too much, that can cause a rapid heart rate. It can cause anxiety. It can cause insomnia. It can cause, diarrhea. It can cause you to feel hot. So it's the opposite. It speeds everything up. And so think about maybe decreasing your dose a bit. Of course, talk to your practitioner. Don't just decrease your dose. I have to say that because I'm a doctor. I'm not your doctor. So I can't tell you in good conscience to make any changes, but that definitely could be. It could just be too much for you. Hi, I'm listening from London. It's nearly 1 a.m. Oh my goodness, you are a night owl. Would appreciate your answer to my question of whether bioidentical hormone replacement can reverse weak orgasm, clitoral atrophy. Absolutely. Probably the number one thing you can do. Have no problem with dryness. Yeah. So when we lose estrogen, our nerves shrink away. So we lose sensitivity, we lose blood flow to our vulva, our clitoris, our vaginal walls. So absolutely, it can totally help. Another thing that is super helpful is DHEA vaginally as well. Can be really good, especially right before sex. It can help increase sensitivity. There's other things you can do, nitric acid, improve your nitric oxide circulation and stuff like that, nutritionally, I mean. But yes, hormone replacement therapy definitely can help. What is the Dutch test? The Dutch test is a dry urine test for comprehensive hormones, measures hormone metabolites in the urine. So it measures the byproducts of the breakdown process of your hormones. See, I'm 44, currently on progesterone, DHA, and testosterone. When would I be expecting to add estrogen? When your estrogen drops. So having testing periodically to see where you're at. And then if you start to have symptoms of estrogen decline, that can be an issue too. That can be how you know. Can your testing show estrogen dominant? Absolutely. So we're going to look at your estrogen. We're going to look at your progesterone. We're going to look at your ratio of estrogen to progesterone. And then we're going to look at your testosterone and DHEA. So we'll be able to see if you have too much estrogen in relation to your progesterone. This could be for two different reasons. This could be because you're producing too much estrogen, or it can be because you're not producing enough progesterone. So you can become dominant whether it being too high, or you can be dominant if the other thing that is supposed to be here is dropped, and that's progesterone. So estrogen dominance simply refers to the ratio of progesterone and estrogen to each other. See, I'm on compounded desiccated thyroid medicine. Will BHRT help the thyroid to function better? Will it possibly reduce thyroid medication? Hormone replacement or proper levels, optimal levels of estrogen and progesterone can help support thyroid health. So if you currently have low levels of estrogen and progesterone, bringing those up could help you to have better thyroid output and have a less need for thyroid hormone. That is true. Some women, as they reach perimenopause and menopause, they'll start to have a lot of symptoms of low thyroid, hypothyroidism. And rather than putting them right on thyroid medication, we will optimize their estrogen, progesterone, and testosterone first. And a lot of times those symptoms go away and they have no need for the thyroid hormone. So even if their thyroid numbers are a little bit lower, they can be optimized with nutrition and with estrogen, progesterone, and testosterone balancing. Oh, you're so welcome. Let's see. Do you recommend a 75-year-old woman take bioidentical hormones as pellets? No, I don't actually recommend pellets at all. Pellets tend to give you very, very high levels of hormones. What's in them is not always disclosed, so we don't always know what's actually in the hormones. And I've done so much pellet rehab over the last year of women who are on pellets, and they lost their hair and they've gained a lot of weight and they're irritable and they felt like they're going to get a divorce because these pellets, once they're in, there's nothing you can do. You have to wait 3 or 4 months until they get kind of out of your system. And what happens is you get a high rush of hormones right away, and then they kind of dwindle out. and you're just stuck. So no, I the only people I sometimes recommend pellets for is younger women who are like in their 30s and they have severe hormone decline. Then they can kind of handle a higher dose of hormones. And if they're super busy and they can't be bothered to remember to take their hormones, but I definitely don't recommend it. Not, especially not for a 75-year-old woman. I totally don't recommend the pellets. So it seems quite expensive. Yeah, I don't really care for pellets at all, especially for older women. I think it's too much hormones. But again, that's me. So if you have pellets and you love pellets and you've had a good experience, because some people do, then by all means, if you're happy with what you're doing, then, definitely keep doing it, enjoy it. Just make sure you talk with your doctor about what's actually in it and if there's any risks. Let's see, can our nerves actually come back vaginally if our clitoris is shrunk by 90%? I wish it didn't go on so long. Yeah, your nerves can come back to action and your body is incredibly able to heal itself and to regenerate. It will take some time. The longer you are without your hormones and your sensitivity, the longer it might take to get it back, but it definitely can come back. And a lot of it's blood flow, a lot of it is hydration, a lot of it is, the anabolic action of estrogen to build. And so definitely it can take some time, but it will definitely improve for sure. Let's see. Would you recommend hormone replacement if FSH level is 4.35? So that just means you're not yet in menopause, but if you have symptoms and you have low levels of hormones, then yes, I'd recommend hormone replacement. So you don't have to be in menopause to start hormone replacement therapy. You can totally start in perimenopause, and you can even start before that if you just have low hormones. So there's not like an age limit, and there's not an entry age. I mean, I usually don't recommend hormone replacement for teenagers because generally most of their problems are going to be helped by lifestyle. So I'd always, if you're younger, if you're not quite in perimenopause yet and you're having hormone issues, I'll always start with lifestyle first. I wrote a whole book. That book back there, it's backwards. That book back there is Hormone Harmony Over 35. It's not about hormone replacement at all. It's all about the lifestyle ways to balance your hormones, but that only really applies if you're able to still make hormones. And if you're postmenopausal, you're not able to still make hormones, then the replacement is really the only answer. Of course, lifestyle is also important because we have our adrenal glands, we have our thyroid, so we also need lifestyle. But yeah, you don't have to wait. How long should I be off birth control before testing my hormones? You can test it while you're on hormones because we have a reference range specifically for birth control. So we're able to kind of like mitigate that. But I would say if you want like your real levels, I would say 3 to 6 months, probably closer to 4 to 6 months to get your natural levels back after being on birth control. It does depend how long you've been on the birth control for. If it's been years and years and years, yes, the 4 to 6 months. Otherwise, you might be able to do that 3 months to see where you're at. If you're older, like if you're in your late 40s and you get off birth control, you may never get your hormones back just because your body's already on that decline. So it really depends. But we do have women who start their testing while they're on birth control, and they even do hormone replacement while on birth control because a lot of times the birth control is just a low dose progestin and they're not getting any estrogen or testosterone. Let's see. Is it possible to pay $139 to have my levels checked before signing up? Yeah, we actually offer a hormone trio test. If you go to our website and you go to shop on our website, across the top, there's like the blog, there's about us, there's shop, and then you'll go to laboratory testing, and then you'll go to hormone labs. There's a hormone trio. You can purchase it right off our website. There's no commitment. We'll just look at your hormone levels and we'll tell you what they mean. So that's not part of the Healthy Hormone Academy. Healthy Hormone Club contains testing throughout the year, consultations. We give you all your hormones, all your shipping. You get the Healthy Hormone Academy, which is all the lifestyle, and you get access to your portal, and you get support from our hormone specialist. So that's all inclusive. But if you just want a hormone test, that is, and that doesn't come with a consultation, but it does come with a explanation. So you can totally do that. Let's see, estradiol definitely helped me help the slightly wrinkly bags under my eyes literally within a month. That's the first benefit I noticed. Awesome. So Lisa is living proof that I didn't implant her there. She's just telling you, yeah, it does it. It's actually like my skin has changed so much from restoring the estrogen. It's one of the first things that goes. And a lot of women are going to get, Botox and fillers and treatments to kind of restore the collagen in their face. But some women are doing this and they're like, I don't feel like I'm getting anywhere, because when we lose collagen after age 30 a little bit at a time, but then when we hit menopause in the first 3 years, we lose like 40% of our collagen. It's ridiculous. It's so much gets lost. That's why we feel like we've aged overnight. So that is awesome. Thank you for saying that. Let's see how long I already answered that. I think I got all your questions, you guys. Let's see. Oh no, let's see. Unfortunately, 5 years ago, I had to take progesterone pills because I had too much estrogen. See, I was wondering if I should start taking estrogen again, or I wonder if I started taking estrogen again, if I would develop adenomyosis. Okay, so like overbleeding, like endometriosis, but outside. I understand that the new blood work might not be a problem. I wrote before, but my question wasn't answered. Let's see. So 5 years ago, you took progesterone because you had estrogen dominance. So you're wondering if you should start taking estrogen. I would test to see where your estrogen levels are, so you know if you need estrogen or not, and if you have symptoms of low estrogen. So I would definitely start there before anything. Just because you've had an issue before with estrogen dominance doesn't mean you'll have it again if you start supplementing, because hopefully you're working with someone who's going to continue testing you so you can make sure that your hormones are balanced. The problem you had was because your hormones were out of balance. So when we're replacing hormones, we have the opportunity to replace them in a balanced way to protect you from having any issues. Let's see, I'm 69 years old. Is it too late for me to start any kind of HRT? My doctor put me on estradiol for vaginal dryness and painful sex, but I do not have any kind of sex drive. I'm also having other problems. Yeah, it's not too late. There's not a time limit anymore. There's not an age limit. We'll look at your health. We'll look at your current state of health. We'll look at your symptoms, and we can put you on a program that's right for you. It's going to look different than a 40-year-old's hormone replacement. Everyone's program is going to be different for as far as which hormones they're replacing, where they're putting them, how much hormone, but we can definitely cater a program for everybody. Let's see, I take Bias cream and have night sweats early in the morning. If I increase the sweats get worse. Am I taking too much or too little? I noticed that my breasts have increased since taking it. Is that normal? So if your breasts have shrunk due to low estrogen, then they will fill out again. If you're taking estrogen, it's possible that your estrogen is not balanced with your progesterone, and that's why you're having those issues. So even though estrogen causes night sweats, lack of estrogen, imbalanced estrogen and progesterone can also cause that. So I would look at your hormone levels and see where the balance is, and you might need to adjust. Can imbalanced hormones cause periclitoral abscess? I'm sorry, I'm not wearing my contacts. I'm 45. I've gotten rid of them a few times in the last few years. Once my period ends, it could be a reason why that's happening for sure. I would check with your gynecologist, see if she has any other insights of other reasons why that might be an issue. But yeah, imbalanced hormones can definitely be at the root. Let's see, how does hypothyroidism, Graves' disease, Hashimoto's play a role in menopause and taking bioidentical hormones? So I think I already I talked about hypothyroidism. So you're asking about hyperthyroidism. Same thing. When hormones are out of balance, it hurts your thyroid. So when we get our sex hormones back in balance, it helps our thyroid. It's the endocrine system. So think of the endocrine system like a team. So we have our ovaries, we have our thyroid, we have our pancreas, we have our adrenals. Those are all and we have our liver. You can call your liver part of that too, because your liver is really important for the endocrine system. So those are all endocrine organs. And if one of them's suffering, it's like a family. If one of them's hurt, the whole family is hurting. And so if one person on a team, if you have a baseball team and one person really sucks, and they're not pulling their weight, then the whole team suffers. Same thing with your endocrine organs. If one of them is having a problem, the other ones are going to have problems. Just like your adrenals. If your adrenals are out of whack, and you're making a bunch of cortisol, that's going to put a damper on your estrogen and progesterone. If you're making too little estrogen or too much progesterone or vice versa, that's going to cause a strain on your thyroid. And so, yes, definitely having balanced hormones, sex hormones, is never a detriment to the other endocrine organs. Oh, you missed the answer to your question. Oh my God. Is there a certain time of the month you should run a thyroid panel, or does it matter? It doesn't matter. You can run a thyroid panel any time of the month. I would just recommend running a thyroid panel. If you're taking thyroid hormones, don't take your hormone that morning. So skip it, take your test, take your thyroid hormone after. If you are sick or highly stressed, I would try to take your thyroid test when that's not happening. But yeah, you don't need a certain time or a certain day of the month for your thyroid. How does low cortisol affect BHRT efficacy? So low cortisol will not affect your BHRT efficacy, but what it will do is it might give you some symptoms. So low cortisol is going to give you fatigue. It's going to give you some other issues that can be sometimes overlapping with symptoms of low hormones, but it's not going to hurt the efficacy of your hormones. They're still going to work the same, but you might see less benefit if you have low cortisol because you're going to have symptoms from low cortisol. So you want to support your thyroid, your adrenals as well. We always look at adrenals, we look at thyroid, we look at blood sugar, we look at the whole picture in our program. We will recommend adaptogenic herbs if you have high or low cortisol, because that's going to help regulate that. If you have super low cortisol, we might recommend a tincture to help extend your cortisol and help you with that. So there's other things we can do as well in natural medicine. Can hormones be balanced with diet, supplementation, rather than HRT? So if you are still of age where you are producing estrogen and progesterone from your ovaries, absolutely. I have a whole book back there, all the ways to naturally balance your hormones, diet, exercise, stress reduction, supplementation, the whole 9 yards. If you are postmenopausal or perimenopausal and your ovaries are not making enough hormones, there's no amount of food you can eat. There's no herb you can take. There's nothing you can do to make that ovary make estrogen again, or make your ovary make progesterone again. So no, you cannot do it with food. You might be able to help some of the symptoms with food. So you might be able to get some symptom relief with different herbs or different foods. But the main reason, I mean, we talk about hot flashes, we talk about low libido, we talk about vaginal dryness, we talk about skin, hair, and nails. Those are all really important. But the main reason why I recommend hormone replacement therapy, and the main reason I talk about it all the time, is because by not replacing your hormones, by doing nothing, you're putting yourself at higher risk for heart disease, higher risk for Alzheimer's and dementia, higher risk for osteoporosis, higher risk for cancers of many different types, and a higher risk for dying earlier. So to me, the risk is not replacing your hormones. So not trying to like ride it out or tough through it or let nature take its course or all those things I used to think that we should do because, I was like, be as natural as possible. But when you think about it, we have running water and that's not natural. We have electricity, that's not natural, but we're using it because it improves our quality of life. If you start to lose your eyesight, you're not like, oh, well, just like let nature take its course. No, you're going to get glasses or contacts or something to improve your eyesight so you can see and you can function in the world. Same thing, like when your ovaries stop working, you got to replace those things so you can have quality of life and you can actually function in the world. All right, let's see. I think I'll just try to answer some more questions here. I take thyroid medicine for hypothyroid. My blood sugar went up as the dosage was increased. Yeah, that could happen because there's like I said, your system is all connected. So I would just work with your doctor on that. Let's see. Are your compounded bioidentical hormones compounded specifically for each person? No. So we don't have a compounding pharmacy. We have a facility, a FDA registered facility where we manufacture hormone creams. We're going to tell you how much to use and we're going to send you a certain strength of the cream and certain, whether we send you a combination cream or individual creams, at which strength we're going to cater that to your individual test. So there's going to be, you might use 2 pumps of the estrogen progesterone combination, where somebody else might use a pump of the higher strength estrogen and 2 pumps of the lower strength progesterone. And there's all these different combinations, and we can adjust up and down based on your symptoms with the hormones you already have. So compounding pharmacies, the reason why we don't use those is because, one, they're not FDA approved, and 2, they, not that I have anything against them, because I do feel like compounding pharmacies have their place, but a lot of times I have no control over the base cream in the compounded cream. So sometimes they'll have parabens in it, sometimes they'll have phthalates in it, sometimes they'll have DMSA in it. So I have no control over that, and I have no control over the consistency. And also sometimes there's more hormones in the cream, sometimes there's less, just based on the person mixing them. So doing it this way, we have standardized, we're able to have the label actually is what it says. So I know exactly what's in it all the time, and there's no variance. So hopefully that's helpful. See how much higher risk percent by not replacing. I've been tapping it through. Well, it depends on what you're talking about. So there's quite a bit of research and studies you can Google, but I have some studies that if you want to email support@naturalwellness.com, I can send those over. But let me see, I might be able to pull, I don't have it right now in front of me, but yeah, it's much lower risk of many different types of cancer, heart disease risk. It depends on the year, how many years you've been using the hormones or how many years we've been without the hormones. But I know that the average life expectancy of women who have used hormone replacement therapy versus women who have not, it's an increase of 7 years as of right now. That's what the research is. So yeah, don't talk through it. It's not worth it. Awesome. All right. I think I got all the questions, you guys. Let's see. Oh, how do you feel about estrogen patches? Those are fine. And the reason why we personally don't use them in our practice is because there's a lot of women who have sensitivity to the adhesive. So the adhesive is it's irritating for most women. So we try to use the most gentlest option that has the least side effects across the board. And that's the pure cream that I have control over. What's in the base is all plant-based. It's all, super clean. And I have control over all the other stuff as well. Let's see, I'm joining late. What about hair loss? Both my estrogen and progesterone are low. Yeah, so when your estrogen and progesterone are low, there are a few things that happen. One, the follicles don't work as well, so you're not having that regrowth. And then 2, when we lose our estrogen and progesterone, when our ovaries stop working as well, our progesterone usually drops first, followed by our estrogen, and our testosterone can still remain our normal female amount. It's not high, but it stays where it is for a little while. And we have a decrease in something called sex hormone binding globulin. So sex hormone binding globulin decreases when estrogen decreases as well. And this means that any of the testosterone that was bound up before, because we weren't using it, is now free. So now you have a situation where you have testosterone dominance. And testosterone dominance, when you have an absence of estrogen, you still have a decent amount of testosterone. That causes hair loss, that causes facial hair, that causes belly fat gain, and it causes irritability. And so that's a problem there. That's one of the reasons for hair loss. And also, if you remember, if you've ever been pregnant or you've ever, know someone who's been pregnant, when you're pregnant, your hair gets thick and shiny and like full. That's the progesterone. That's the higher levels of progesterone and higher levels of estrogen that you have when you're pregnant. So when you lose your estrogen and progesterone, you start to lose your hair. You have more breakage and it doesn't grow as well. So let's see. I'm taking DIM, but my PCP said because of hair loss, I should not take progesterone. No, I don't believe in that at all. You should definitely take progesterone, especially if you want shiny, full hair. Let's see. If we join the club, can we ask to have a thyroid test also to be sent? Absolutely. Yes, you can pretty much add on almost any test. We have, cholesterol tests, glucose tests, mold testing, gut testing, microbiome testing, liver toxicity, and the whole 9 yards. We offer all testing. So if you're in the Healthy Hormone Club, you have access to our testing, and you can do it a variety of different ways. For a thyroid test, we can send you to a lab to get your blood drawn. You can also do it via blood spot as well. Just from the comfort of your home. So it's up to you. But yeah, you can definitely get that done. And again, it's healthyhormoneclub.com for those of you who are asking if you just want to sign up. If you have not seen our masterclass, that is what every woman needs to know about hormone replacement or hormone restoration. It pretty much gives you a little more of like a class. I've been answering questions like randomly, but this is more of a class. And that's at fixhormones.com. So fixhormones.com is to sign up for the class. And if you just want to join the Healthy Hormone Club, that's healthyhormoneclub.com. Remember, if you sign up between now and December 16th, we're going to donate a really nice present to a child in need for every person that signs up. And you're going to get free access to the Healthy Hormone Academy, which we are going to be selling after Christmas or around December for about $399. So that's a $399 value. That's absolutely free. So hopefully that helps. Healthyhormoneclub.com. If you have more questions and I didn't get to them, I tried to get to almost every question. I'm pretty sure I did, but I might have missed a few in the chat because I've been looking in the Q&A, but I think I got the most of them. So if you didn't get your question answered for any reason, you can post it under the replay when I send the replay out tomorrow, or you can message me on social, or you can email support@glownaturalwellness.com. Thank you guys so much. It was so fun hanging out with you. I love talking about hormones, you guys. So this is always fun for me. And I hope I kind of made some sense and dispelled some of the myths and misconceptions and made it a little more understandable for you guys. Awesome. Yes. So I'd love to see you in the Healthy Hormone Club. But until next time, have a great night, you guys. I will talk to you soon. Oh, we didn't have the prize patrol. Hold on. For those of you who know, stay tuned because Paxton's going to come give out some prizes. So hold on just a second again. Paxton, can you do the prize patrol? Yeah. All right, Paxton's coming in now. He's going to do prize patrol. All right, so we're going to give Daily Glow. So we're going to do a bottle of Daily Glow. This is our top-notch physician formulated. I'm the physician that formulated it. It's hormone, thyroid, adrenal, support, plus all your multivitamin, multi-minerals. It's amazing. It has those adaptogenic herbs to help your thyroid. Has DIM for hormone detox support, methylated B vitamins if you have any methylation issues. So this is like the big daddy of all supplements, Daily Glow. We take it every day. So Paxton's going to pick someone in the chat. What do you want them to say in the chat? So
the first word that came to my mind, cow.
Cow? Okay. So write cow in the chat, moo cow, and Paxton's going to pick 2 people to win a bottle of Daily Glow. And a copy of my book too, so you can have all the natural ways to heal your hormones. And if you're watching on the replay, we're going to pick another person as well. Uh-oh, there's a lot of people saying moo cow. You gonna pick that one? All right, so Joyce that said moo cow moo. Go ahead and email us at support@glownaturalwellness and let us know that you want a bottle of Daily Glow and send us your address so we know where to send it to. All right, you want to pick another person?
Yeah.
And Paxton's the one that's going to be picking out the presents for the people that join the Healthy Hormone Club. He's going to be picking out all the presents for the kids in need.
You're welcome.
Oh, we got some creative people here. You want to pick that one? That one? Which one? Put your mouse over.
And
wait, this one?
No.
Oh, so I said, will you put the I didn't see it. I'll read it once. Okay, Patty that has a little picture of a cow. Oh, I will give it to Patty and Teresa. Teresa, who have little icons of a cow's head and then a cow body, and then Patty that had a cow underneath. Email support@glownaturalwellness.com and tell us your address and let us know you want a bottle of Daily Glow. All right, good.
Hold on.
Oh, God, so to do another one?
No.
Oh, you just want to read all the chats? I'll let you read them later.
No.
Huh? right, we're gonna finish up here and then I'll do it out. Oh, are your supplements organic? They contain organic ingredients, but they are not 100% organic because with supplements, in order to get the most bioavailable forms of each ingredient, like for instance, like the like vitamin 6, peroxyl 5 phosphate. That's how it comes. That's the most bioavailable form. That can't be organic because it has to be kind of extracted in the lab. So it's not considered 100% organic, but it's made with organic ingredients. Everything that can be organic, like the herbs, are. But the certain forms of the vitamins, like the methylated B vitamins, in order for them to be methylated, it's a process in the lab. So thank you. Paxton's awesome because he found that. So awesome. So if you won the prize, email support@glownaturalwellness.com and we will send you with your address. So make sure you give us your address and let us know you want a bottle of Daily Glow, because I do these all the time and sometimes people are late at the prizes. So just so you know, whenever I do Q&As, I usually always do prizes. We put the links you mentioned in the email tomorrow. So I talked about the 99 symptoms guide. So I'll send that. What other links did I say, you guys? I should wrote it down. Oh, Estrogen Matters book. I'll put that in there. And then I'm going to send you guys a link to a paper by one of my favorite researchers, Dr. Berkson. She wrote this extensive paper called Estrogen Vindication with all of the studies to back it up. And it's absolutely pretty awesome. So I'm going to send you guys a copy of that as well, or a link to it. And then let's see. Awesome explanation of Daily Glow Organic. Thank you. Fix Hormones. Oh, fixhormones.com is the masterclass. Yep, we'll send that. And then the Healthy Hormone Club will send you that as well. Awesome, you guys. Thank you so much for everything. It's so good spending time with you. I'm going to let you guys go now. I think, let me see if there's any more questions that I didn't answer. Yes, awesome. So I'll put all those links in the email tomorrow. I'll try to get this all compressed and everything so we can send it out at some point tomorrow to you guys. All right. Have a great night. Take care. Bye-bye.